Hello, as part of your clinical practice as a HCA healthcare assistant, and also to complete your module, it's very important you understand some of the basic knowledge, skills you need to have in supporting MDT on the ward when we talk about a multidisciplinary team. So now, as a healthcare assistant, if you have studied our level 2 or 3, courses, we expect you to have understanding when we talk about the role of a healthcare assistant. Some people call it support worker, or depends on where you work, care support worker or mental health support worker. So you need to have good knowledge when we talk about patient assessments. So there are some patients who have been brought onto the ward. You need to have basic knowledge of when patients come onto the ward or come into hospital. What are the things that you need to do to support the nurse and making sure you complete your task for the day? Say, for example, let's look at mental health setting. You might have a patient brought in for depression. So now you need to have mental health awareness and also have basic knowledge when we talk about the risk to people with depression. So at the same time, you need to also understand when the patient are coming in, what are the high risk that brought the patient there? Is this self-harm? Is it a patient not able to sleep? So someone who are not able to sleep for 2 or 3 days. So you need to understand some of these symptoms this patient will be presenting. So your ideal role is just to assess what is happening, and at the same time, documentation is very important. So the nurse can ask you to go and sit down with patient. Because if patient is being admitted first time, they might put the patient on observation, depending on the trust or the community, the hospital you are working. They can ask you to observe patient, maybe eyesight, just for you to see the patient, which some of them have different level 2, level 3, level 4. So you need to understand what they mean during your induction to work in this hospital. So I'm going to use the word intermittent, 30 minutes or 15 minutes. I'm also going to use the word general observation, just to check the patient's run, which is hourly observation, know where the patient is about. And another one is also eyesight. You can see the patient. At the same time, another one is one-to-one. So one-to-one and eyesight is actually nearly the same. The difference between one-to-one is that you can be in a patient room doing one-to-one and having conversation with the patient, engaging the patient in activity, at the same time also checking the patient history in terms of breathing, have they had food to eat, is there some medication that you need to remind the nurse that they need to have in a certain time. So, and also how many milligrams the medication have, or also the side effect. So that these are the basic knowledge you need to have in that particular time. It's not really that big deal for you to have awareness of all this medication management, maybe do safe medication management or principles of safe medication, where you understand when we talk about 5 rights of giving medication. So this can actually help you to get more shift when it comes to getting the right staff to work with the right patient, or to support registered nurses to provide evidence-based care. So now, the other one is training. Your training is also very important. When we talk about clinical practice role for caregiver, healthcare assistant, you need to understand your responsibility in completing all your mandatory training. OFC College can also support you with this. We provide mandatory training. We also provide award training. We provide certificate training. We also provide diplomas. So depending on your development stages, as you are doing your job, whether you are working with OSA First Care Recruitment, or you are working with our agency that we partner with, or agency that will support you with when you register for work-based training and job application support. So we are also accredited CPT organization. Everyone know that. Recently, we also have a WAQC accreditation that help us to provide diploma and every other work-based education. We help people to complete NHS professional application for those who want to work with the NHS. We provide this training when we talk about this clinical practice skills knowledge for HCA to support people so that when they get a job in the NHS, they'll be able to know what to do. So now let's go back to the role of healthcare assistant, support worker, or HCA. We talk about training. These are your responsibility. So now, once you have this basic knowledge, you are competent when it comes to training. Also, you also need to know the role of nurse. What are the role of nurse? So the role of nurse is start from the same assessment, diagnosing patient, and also treating patient. Let's talk about Mental Health Act, 1983, updated 2007. So any patient that is under mental health regulation that is detained in hospital have the right to be assessed, right to treatment, and the right to be treated in the right environment. Yes, and also have the right to be mentored, to support, to gain the right services that they require. If the nurse is not able to provide the service, they can do a referral. So these are basic knowledge that HCA or healthcare assistant need to understand in supporting nurse to promote evidence-based practice in hospital, care home, or community. So now, you need to also do some mental health awareness course, level 2 or level 3. If you are part of those taking our award in clinical practice, mental health clinical practice, good for you. So this clinical practice skills or section is for you to have all this basic knowledge, to have this understanding skills, so that when you go into hospital, care home, you know what to do because you have graduated from OFC college. So you need to have mental health awareness to understand depression. Say, for example, someone who is suffering from depression might need support with a tool to support their intervention to treating the depression. So now, let's talk about CBT, which is cognitive behavioral therapy. The nurse will be able to refer a patient to the therapist that will be able to support patient with depression with the CBT. At the same time, how long is the CBT going to work? Is it long-term, short-term? A majority of the time, evidence is based on the short-term. That is why the recommendation is to support this patient with medication. So these are basic knowledge, isn't it? So supporting patient with medication, you might need to be able to know 1 or 2 medication. Let's say sertraline. If patient is being given sertraline, you need to understand that the nurse role is to check the BNF. So what would you find out in BNF? BNF will give you how the patient take the medication, if it's by mouth, how the patient take the medication, is it like sertraline, start with 50 milligrams. Intervally, you need to increase it with 50 milligrams. The maximum dose for sertraline is 200 milligrams for adults suffering from depression. So these are basic knowledge, isn't it? So you need to also know the side effects for sertraline, for that medication. These help you to give appropriate observation, assessment, and making sure your role as a healthcare assistant is effective during your shift. Yeah. So now, you might also be asked to go and do news observation. So when we talk about news observation, we're talking about National Early Warning Score, where you use the blood pressure, you use the oxygen saturation, use the temperature oximeter. Maybe sometimes the patient has been admitted onto the ward. You will need to also use to find out their weight, their height. You find out the ward. You ask the ward, what are the basic tools to use for all this? During your induction, this question can be asked, or when the patient comes in. I can't remember every tools that you use to support patient with all these services. So what I do is to work with other people on the ward. This is where you need to have good communication. with individual or people to support you, work in collaboration to provide evidence-based care so that you can promote the good outcome when we talk about patient outcome. So now, news observation. You will need to find out how to check respiration. You will need to also find out how to check patient pulse. You need to find out how to check patient oxygen, how to check patient blood pressure, how to find out if patient is alert. So these are the record. These are things you need to put down for your news observation. You also need to find out different level of score in news observation. When we talk about score, level score 1, 2, 3. So, and the risk of these scores and what we mean by sepsis. So, for you to ring emergency and how to contact the emergency service or how to contact the nurse in charge. Who is your nurse in charge? The lead team. So, it's very important. This awareness, this orientation, you understand them. You also need to understand how to observe patient physical ability, orientation, their insight, because patients who are suffering from mental health issue or who are having to diagnose with depression or any other mental health disability, the WHO recognized mental health issue as mental health disability, mostly depression. So you need to be able to have this evidence-based practice when we talk about clinical practice for a care worker, support worker, or caregiver. As part of this course, these are the basic awareness, basic knowledge, basic skills you need to have. If you need to practice news observation in one of our center or with any of OSC team in your community, let us know. We will be able to support you with this. So now, congratulations, you have completed this module. When we talk about clinical practice for caregiver, you can be able to do this job. You can be able to work as a support worker. So you need to contact your assessor or your tutor or your college duty lead for your assessment, and then for you to be able to get your certificate and to go and work as a healthcare assistant. So thank you for training with OFC Training College, OSA First Care, and also thank you for listening and taking part in this course.